Welcome to our podcast channel, Let's Talk About Cancer, the podcast that explores everything about cancer and the latest treatment options available. Today's episode is titled Surgical Management for Oral Cancer, and I am your host, Dr. Satish with you. In this episode, we'll be discussing the role of surgery in the management of oral and face cancer and the different surgical approaches used and what to expect after the procedure. Oral cancer is a type of cancer that affects the mouth and the throat. Surgery is one of the main treatment options for oral cancer and is often used in combination or followed by radiation therapy and chemotherapy. The goal of surgery is to remove all the cancerous tissue along with some normal tissue to extract the tumor along with its roots while preserving the function and appearance of the mouth and throat. There are several different surgical approaches used to treat oral cancer, including a wide local excision. This involves removing the tumor and a margin of healthy tissue around it. A Mohs micrographic surgery. This is a specialized surgical technique when tumor is located to important organs such as the eye, in which we cannot remove with a very wide margin. So this involves removing thin layers of tissue around the tumor and examining them under the microscope while the surgery is still going on till all the cancerous tissue is removed to remove the cancer in total while preserving the vital organs. And a neck dissection, which involves removing the lymph nodes in the neck that are or may be affected by cancer. The type of surgery used will depend upon the location and extent of the cancer. Sometimes multiple layers of tissues need to be removed as well. After the surgery, a good form of reconstruction is required to reconstitute the defect that has happened so that the patient may be whole again. And after the surgery, the patient may experience some pain, swelling, difficulty in swallowing, and difficulty in speaking. However, these symptoms are usually temporary and can be managed with pain medication and other supportive measures, and they can be given time with a rehabilitation expert to learn to speak and to learn to swallow afresh. Patients will also need to follow a specific recovery plan that includes rest, a semi-solid to a liquid diet initially, followed by a soft diet and a blended diet as per the patient's surgery. And they will need regular follow-up appointments with their doctor. It is important to note, while surgery is the best option, it may not be the only option or it may not be best for every patient. Some patients may not be candidates for surgery due to their overall health or the location of the tumor or the extent of cancer. In these cases, radiation therapy and or chemotherapy may be used as alternative treatment options. In conclusion, surgical management is the most important part of the treatment of oral cancer. There are several different surgical approaches used, and the type of surgery used and the reconstruction that is used will depend upon the location, extent of the cancer, and the individual patient. If you or someone you know is affected by oral cancer, speak with a healthcare professional to learn more about the surgical options available. Thank you for listening to Let's Talk About Cancer, and we'll see you on the next episode.